Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Valproate sodium. This valproate sodium is actually a carboxylic acid derivative. Valproate sodium is a carboxylic acid derivative. It is used as a solvent for antiepileptic drugs. This valproate sodium is an ionized drug, and the activity of this valproate sodium is mainly due to the valproate ions. The valproate sodium has a simple chemical structure. Mechanism of action of valproate. Valproate will inhibit the sodium channels. It will inhibit the sodium channels. It will inhibit the calcium channels, that is T type of calcium channels are inhibited. It will also inhibit the NMDA channels, and it will stimulate the glutamate decarboxylase. Then it is also an histone deacetylator, the histone deacetylase inhibitor. So valproate sodium has four actions. It inhibits the sodium channels, it inhibits calcium channels, that is T type of calcium channels, it inhibits NMDA channels, it stimulates glutamate decarboxylase, and it is a histone deacetylase inhibitor. Then pharmacokinetics. In the pharmacokinetics, valproate is well absorbed, and it is a 90%, it is almost 90% protein bound. This valproate is metabolized by a non-CYP enzyme, but this valproate is an inhibitor of CYP. Though it is metabolized by a non-CYP enzyme, it is an inhibitor of CYP enzyme. Then drug interactions. In the drug interactions, valproate mainly it inhibits the metabolism of clonazepam. So thus it can precipitate status absent sorry it inhibits the metabolism of the clonazepam. So valproate inhibits the metabolism of clonazepam. Thus this will increase the clonazepam levels in the blood, causing its toxicity. Then it also inhibits the metabolism. Sorry, it also this valproate will also inhibit the metabolism of one more drug, which is lamotrigine. When it inhibits the metabolism of lamotrigine, it increases the toxicity of lamotrigine by increasing the level of lamotrigine in the blood. Valproate also induces the metabolism of carbamazepine. When it induces the metabolism of carbamazepine, this will decrease the levels of carbamazepine by around 75%. When it decreases the level of carbamazepine by around 75%, the carbamazepine in the blood decreases. So carbamazepine cannot act um, due to its less therapeutic effect, because the dose of the carbamazepine is less than the therapeutic efficacy. So as a result, the carbamazepine cannot act. So as a result, you will see the symptoms of the disease will manifest. Phenytoin will also induces the metabolism of valproate, and thus the valproate levels decrease in the blood, and thus valproate cannot act on the um, disease. Then uses of valproate. Valproate is actually used as drug of choice for generalized tonic-clonic seizures. It is used as drug of choice for generalized tonic-clonic seizures, myoclonic seizures, atonic seizures, mixed seizures. It can be used in akinetic seizures. It can be used as a drug of choice for atypical absence seizures. Resistant epilepsy also we can use valproate as drug of choice. So, and in all these conditions, valproate is a drug of choice. So, valproate is a drug of choice in generalized tonic-clonic seizures, myoclonic seizures, atonic seizures, mixed seizures, akinetic seizures, atypical absence seizures, and refractory epilepsy. Valproate is also a drug of choice in a type of bipolar disorder with rapid cyclers. In them, valproate is the drug of choice. Other uses are valproate is also the drug of choice for prophylaxis of migraine. Or valproate is also the drug of choice for bipolar disorder, especially in the treatment and maintenance. Both we can use valproate. Then valproate can be used in tardive dyskinesia, and it is also used in neuralgia. Then the side effects of valproate. The side effects of valproate are the most common side effect is GI upset is seen. The valproate can cause weight gain, tremors, or increase in it can cause increase in liver enzymes. This can also cause hyperammonemia, or this can reduce the folate utilization, thus resulting in neural tube defects can occur due to valproate. It can cause acute pancreatitis. Alopecia can occur, followed by development of curly hair can occur, and this does not cause sedation. Valproate does not cause sedation. Valproate can result in polycystic ovarian disease also. Valproate can also result in polycystic ovarian disease. Now, there is development of idiosyncratic hepatitis is seen by valproate. So, what is idiosyncratic hepatitis seen in valproate? So, this idiosyncratic hepatitis is mainly seen in young babies less than 2 years of age. So, it is more common in babies with L-carnitine deficiency. In them, there is increased chances of hepatitis with valproate, and this chances of this idiosyncratic hepatitis is seen at the fourth month. If the valproate is introduced in the fourth month, then we can fourth month on the fourth month of introduction, there is increased chances of developing this idiosyncratic hepatitis in the children. So as a result, this valproate is actually avoided in younger children, in young babies.
Thank you and thank you for watching.